Top 10 Reasons for Hair Loss 2022. Hair loss, also known as alopecia, can affect your entire body or simply your scalp, and it can be temporary or permanent. It could be caused by inheritance, hormonal changes, medical issues, or simply aging. Men are more likely than women to lose hair on their heads. Baldness is a term that describes significant hair loss from the scalp. The most common cause of baldness is hereditary hair loss, as people become older. Some people may rather leave their hair loss untreated and unnoticed. Hairstyles, cosmetics, caps, and scarves may be used to conceal it. Here are the top 10 reasons why you have hair loss. Reason number 1, age. As people become older, almost everyone will notice hair loss and thinning. At all ages, our cells develop and die, but as we become older, our cells die off more quickly than they renew. It's why our bones become weaker and our skin becomes thinner. Our hair goes through a similar procedure. We create less oil in our scalp as we get older, which can cause our hair fragile and brittle. This can also lead to hair thinning and loss in general. Androgenetic alopecia, or pattern hair loss, is a condition in which some people have increasingly severe hair loss as they get older. Reason number 2, genetics. The most prevalent type of hair loss is androgenetic alopecia. Male or female pattern hair loss is a condition that affects more than 50 million men and 30 million women in the United States. This is a more severe type of hair loss that usually starts in early adulthood and worsens with age. This form of hair loss commonly begins around the temples and spreads to the top of the head in men. There may be some thinning at the top of the skull as well. Females usually notice it initially where their hair is divided, although there is gradually thinning all over. Although the hairline usually remains the same, the hair part can widen. Researchers have found that the number of genes affects how likely you are going to experience hair loss rather than the common belief that pattern hair loss is inherited from the mother's side of the family. Reason number 3, stress. Have you ever felt stress at work? Have you ever felt stressed about paying your bills, getting a job interview, or getting good grades at school? Well, this is you then. Stress can also affect hair loss. Sometimes, if you worried too much about losing hair, you will see hair follicles falling on your pillow and in the shower drain. This is a medical term called telogen effluvium. Telogen effluvium is a type of transient hair loss that occurs as a result of stress, shock, or trauma. It normally starts on the crown of the head. The hair loss disorder telogen effluvium differs from alopecia areata. A person's hair may fall out in large numbers, although this is usually just temporary, and the hair grows back. It may appear that you are getting bald during a telogen effluvium. You won't, rest assured. Telogen effluvium is a stress response. Hair shedding becomes excessive 2 to 3 months after a stressful physical or mental incident and peaks 4 to 5 months afterward. Your body adjusts over time, and the hair gradually stops falling out. Things return to normal in 6 to 9 months. Losing a loved one, having surgery, or being diagnosed with a serious illness are all stressful life experiences that can cause hair loss. However, hair loss can be stressful in and of itself, creating a vicious cycle. In this case, a hair loss treatment is not necessary because the hair will regrow back in a couple of months, so no worries. Reason number 4, nutritional deficiencies. Severe telogen effluvium can develop into a chronic condition. This form of hair loss is more gradual and lasts longer, over 6 months. Nutritional deficits are frequently cited as possible explanations. Hair loss has been linked to iron deficiency, vitamin D deficiency, and zinc deficiency. Most people are unaware that hair loss is linked to their nutrition. Nutrients, vitamins, and minerals are necessary for healthy hair development. Hair loss is likely if your body does not obtain any of these nutrients from your diet. Nutrient deficiencies have been linked to persistent telogen effluvium, female pattern hair loss, alopecia areata, and androgenetic alopecia studies. As a result, many patients seek dietary advice and vitamin supplements to combat hair loss before exploring hair transplant options. Dietary supplements can generally address vitamin deficits. Always talk to your healthcare practitioner before using any new supplements. Reason number 5, infections. Hair follicles can get infected, causing hair to fall off. Hair loss infection occurs when bacteria, yeast, or fungi overgrow and infect hair follicles. Pustules, redness, and scaling may appear. Itchy or painful scalps are common. Scalp fungus infections are very contagious and the most prevalent cause of hair loss in youngsters. Children should not share hats and scarves to avoid this. Numerous fungal infections can harm your body. It's easy to overlook small cases when there are so many symptoms. However, problems must be addressed as quickly as feasible. It's important to avoid it because even a slight fungal infection weakens your immune system. When this occurs, one of the first things that your body neglects is hair maintenance. In the event of fungal infections that damage your hair, you're more likely to lose your hair permanently in the affected area. This inflammation can boost blood flow to the affected area. The immune cells have to reach the area to aid in the fight against the fungus. The inflammation normally goes away once the fungus is removed. If the infection persists, the cells in that location may be damaged. Scarring develops over time, which might be permanent. Inflammation causes free radicals to develop, which destroy your cells. As the cells die, scar tissue develops in the affected area. This is terrible for your hair since the tissue compresses and constricts your hair follicles. This will make your hair thinner and more like fuzz at first, but it will eventually render you bald in that area. Even if the scar tissue is not resting against the hair follicle, it can nevertheless cut off the blood supply to the hair in that area. This is bad for your hair and will hinder sufficient nutrients needed to keep the hair follicle stable. Consult your dermatologist straight away if you develop any of these symptoms. Number 6. Birth control pills. If you're a woman currently taking birth control pills or have taken birth control pills before this, then that is another reason why you are losing hair. Some women who had stopped taking birth control pills for several weeks or months had also experienced hair loss. Hormones influence hair growth and hair loss. Birth control pills change hormone levels, which can lead to hormonal hair loss. Androgen receptors are found in our hair follicles. Androgens, male sex hormones, particularly testosterone, are produced in modest amounts by the ovaries. The enzyme 5-alpha reductase interacts with testosterone to form DHT, a kind of androgen, which attaches to androgen receptors in hair follicles and causes hair loss. When it comes to birth control tablets, folks can choose one with a low androgen index. This may reduce the likelihood of hair loss. Reason number 7, chemotherapy and radiation. Many individuals who have been diagnosed with cancer and must endure chemotherapy or radiation have a serious fear of losing their hair. Cancer is caused by cells that multiply too quickly. Chemotherapy medications are frequently used to kill these cells and prevent them from forming tumors. On the other hand, chemotherapy might impact your hair follicles to grow swiftly as well. Hair loss can be caused by radiation therapy, which is frequently utilized in cancer treatment. However, unlike chemotherapy, which can cause hair loss all over the body, radiation therapy usually just affects the treated area. Hair loss is usually transient with both types of treatments, and you should anticipate your hair to return in a few months. Reason number 8, pregnancy. Pregnancy is another short-term way of losing hair. At any given time, around 90% of your hair is growing, while the other 10% is in a resting phase. Resting hair goes off every 2 to 3 months, allowing new hair to grow in its place. The excessive loss of hair that occurs 1 to 5 months after pregnancy is known as telogen effluvium. Hair loss is typical during pregnancy, affecting 40 to 50% of women, but, like most changes during pregnancy, it is only temporary. Hair loss is linked with pregnancy and normally occurs after the baby is born. An increased number of hairs enter the resting phase during pregnancy, which is a typical aspect of the hair loss cycle. This condition is not severe enough to result in bald spots or permanent hair loss, and it should fade within 3 to 4 months of delivery. It's possible that while being pregnant, you're having unexpected hair loss due to mineral and vitamin deficiencies. After pregnancy, after 3 months of giving birth is where usually hair loss occurs. The increase in hormones that occurs during pregnancy prevents hair loss. Hormone levels return to normal after birth, allowing the hair to fall out and the cycle to resume. Normal hair loss that was postponed during pregnancy may suddenly fall out. Up to 60% of your hair in the growth phase may transition to the telogen resting phase. As your hair follicles regenerate, hair loss normally peaks 3 to 4 months after delivery. As previously said, hair loss is very temporary and returns to normal. Reason number 9, weight loss. Weight loss can be associated with nutritional deficiencies. Usually, this occurs when people do crash dieting. Crash dieting has a harsh and perhaps deadly connotation. Most health professionals believe that this is a fair description of extremely low-calorie diets that promise rapid weight loss. Crash dieting may sound appealing to have rapid weight loss, but it has a slew of drawbacks that should make you reconsider putting your body through one. A crash diet requires you to cut calories immediately away, frequently to levels below your basal metabolic rate, or BMR, the number of calories your body needs to carry out its basic functions. Your body will lose weight if you limit your calories drastically and change the type of food you eat. Your hair depends on you to nourish it from the inside out with a balanced diet rich in protein, healthy fats, and vitamins and minerals including vitamins C and E, biotin, selenium, and zinc. A crash diet is likely to deplete these hair-nourishing nutrients. As a result, a type of hair loss called telogen effluvium would occur. Reason number 10, brushing your hair incorrectly. This sounds like a silly question, but in reality, there is some truth in this logic. At its most basic level, missing hair brushing will not prevent hair loss, contrary to popular belief. On the other hand, brushing your hair might cause more breakage and a specific type of hair loss in some conditions. Is combing harmful to your hair? When done correctly, combing your hair does not cause hair loss. Check that your comb is smooth and of high quality. Combs with rough edges, chips, or even micro cracks can catch hair and tug it out, or act like a saw, causing hair strand breakage. When combing wet hair, only use a wide tooth comb. When resolving knots and tangles, be gentle when combing to avoid pulling out hair. Brushing your hair, can it cause hair loss? Brushing your hair incorrectly might result in breakage, making your volume appear thinner. Because the damaged hair shaft reduces the overall appearance of your hair's fullness and volume, even if the follicle is unaffected. Brushing your hair incorrectly might induce mechanical stress, which can exacerbate normal hair shedding. When taken to its logical conclusion, it can result in traction alopecia, a temporary form of hair loss that can become permanent if left untreated. Brushing wet hair should be avoided. Brush no more than twice a day. Brush your hair from the top down. Brushing from root to tip might cause breaking and hair loss if knots are encountered. Hairdressers advise holding the hair shaft and brushing the last inch or two first. Move up the hair shaft and brush down again after that portion is clear of knots and tangles. Brush the entire length of your hair until all tangles have been removed. When the ends and middle of the hair are smoothed first, the chance of tangles and hair loss is reduced compared to starting at the root. If you like this video and subscribe for more on the Health Universe channel.